Hello and welcome to our channel. Today we're diving into a topic that's essential to understand when it comes to both mental and physical health: delirium. You might have heard the term before, but what exactly is delirium? How does it manifest? And how can we manage or even prevent it? In this video, we'll explore delirium in detail, discussing what it is, the causes, symptoms, diagnosis, and treatment. Plus, we'll cover some herbal remedies, beneficial foods, and things to avoid to help manage or prevent delirium. Stay with us as we break it all down. Understanding delirium, causes, symptoms, treatment, and natural approaches. Let's start with the basics. What is delirium? Simply put, delirium is an acute state of confusion that comes on suddenly. It is typically marked by agitation, disorientation, hallucinations, and difficulty focusing. Unlike chronic conditions such as dementia or Alzheimer's disease, delirium tends to appear rapidly and is often temporary. However, it's still a very serious medical condition that requires prompt treatment. It's important to note that delirium can be triggered by various underlying conditions and, in many cases, can be reversed if addressed early. Now let's dive into the symptoms. Delirium doesn't look the same in every person, and symptoms can fluctuate throughout the day. Here are some common signs. Confusion. People with delirium may have trouble recognizing familiar faces or understanding where they are. Disorientation. They may not know what time it is or what day it is. Inattention. It's difficult for them to focus on a conversation or task. Hallucinations. In more severe cases, the person may see or hear things that aren't there. Agitation or restlessness. They may appear hyperactive, anxious, or irritable. Sleep-wake cycle disturbances. Individuals with delirium may be very drowsy during the day but restless at night. If you notice these symptoms in yourself or someone you care about, it's vital to seek medical attention immediately. Let's talk about what causes delirium. Delirium is almost always a result of an underlying medical issue. Some of the most common causes include infections. Infections like urinary tract infections and pneumonia, especially in older adults, are common triggers. Medications. Some medications, particularly sedatives or those with anticholinergic effects, can contribute to delirium. Alcohol or drug withdrawal. Individuals who suddenly stop alcohol or drugs can experience delirium. Surgery or anesthesia, especially in older patients or those undergoing major surgeries, anesthesia or recovery can trigger delirium. Metabolic imbalances, issues like dehydration, low blood sugar, kidney failure, or electrolyte imbalances can lead to confusion. Chronic illnesses. Conditions such as heart failure, stroke, or liver disease may cause delirium, particularly when a person's condition worsens. Recognizing the root cause is essential for treatment, and that's what we'll explore next. Who is at risk for developing delirium? Several factors increase the likelihood of someone experiencing delirium, including older adults, especially those over 65, are at higher risk, particularly if hospitalized. Pre-existing cognitive impairments. Those with dementia or cognitive decline are more susceptible. Serious illnesses. People with heart failure, cancer, or chronic conditions are more likely to develop delirium. Hospitalization. Being hospitalized, especially in intensive care, puts individuals at higher risk. Substance abuse. Alcohol or drug abuse increases the likelihood of delirium, particularly with withdrawal. If you or someone you know has these risk factors, it's important to be extra vigilant about watching for signs of delirium. Diagnosing delirium is a thorough process. Doctors will typically perform physical exams and medical history reviews to identify any underlying conditions, like infections or medication side effects. Cognitive tests to evaluate memory, attention, and orientation. Blood tests to check for infection, imbalances, or organ dysfunction. Imaging tests such as CT scans or MRIs if there's suspicion of a brain injury or other structural issues. Doctors will also rule out other conditions like dementia or mental health disorders to confirm the diagnosis. So, once delirium is diagnosed, treatment is centered around addressing the underlying cause. Here are the main treatment strategies. Treat the underlying condition. For example, if delirium is caused by an infection, antibiotics will be prescribed. If it's related to medications, the doctor may adjust or change the dosage. Supportive care is crucial too. Ensuring hydration, good nutrition, and a calm environment helps the body recover. Reducing agitation is another key aspect. Sometimes doctors use antipsychotics or sedatives to calm agitation and prevent harm. Addressing sleep disturbances is essential as well. This can be achieved with changes to the environment or medication. Psychological support is important for long-term recovery. Counseling or therapy may help those who experienced anxiety or confusion after delirium. In addition to these medical treatments, natural remedies can also play a supportive role in managing and preventing delirium. Let's look at some herbal remedies and foods that may help. Herbal remedies and foods for delirium. Let's explore some herbal remedies and foods that can help support brain health and potentially reduce symptoms of delirium. Ginkgo biloba. Known for improving circulation to the brain and supporting cognitive function, it may reduce mental fog and confusion. Chamomile, a calming herb that helps with sleep disturbances and anxiety, common issues for people with delirium. Lavender aromatherapy with lavender oil has been shown to reduce stress and improve sleep quality. Turmeric contains curcumin, a powerful anti-inflammatory compound that may support brain function and reduce inflammation. Bacopa monnieri, an Ayurvedic herb that improves cognitive function and reduces confusion. Beneficial foods include leafy greens like spinach and kale, which are rich in folate and other nutrients that support brain health. Fatty fish such as salmon and mackerel are full of omega-3 fatty acids that are essential for brain function. Berries, like blueberries and strawberries, are high in antioxidants, protecting the brain from oxidative stress. Lastly, nuts and seeds contain magnesium and vitamin E, supporting cognitive function and overall brain health. Managing delirium isn't just about what to include in your life, it's also about what to avoid. Here are some things to steer clear of. Excessive alcohol, as it can trigger or worsen delirium, especially with withdrawal. Sedative medications like benzodiazepines and sleeping pills should be used cautiously as they may contribute to confusion. Disrupted sleep is another factor. Try to maintain a consistent sleep schedule to avoid further confusion. Dehydration or malnutrition should also be avoided, so ensure adequate fluid and nutrient intake to prevent delirium from occurring. Stressful environments, such as noisy or chaotic places, can increase agitation. A calm and quiet space can help in the recovery process. In summary, delirium is a serious but treatable condition that requires early recognition and intervention. By treating underlying causes and utilizing both medical and natural approaches, we can often reverse delirium or at least manage it effectively. Preventive measures like staying hydrated, eating brain-boosting foods, and managing stress can make a big difference too. Thank you so much for watching. If you found this video helpful, please like, subscribe, and share with anyone who might benefit from learning about delirium. Stay healthy and take care. Thanks for watching. Subscribe for more health tips.